If you care for someone with irritable bowel syndrome (IBS), you are probably on call to provide support and treatment when symptoms strike. If you don't want to be running to the drugstore at midnight when your loved one's IBS kicks in, it's a good idea to stock your medicine cabinet with a few medications and other products that can help ease IBS symptoms. Treating IBS symptoms, over-the-counter medications. There are a number of over-the-counter (OTC) medications that might be a good idea to have on hand when you're the caregiver of someone with IBS. Symptoms can vary, so it's a good idea to have a wide variety of remedies. That way, you'll be prepared no matter which IBS symptoms you encounter. Anti-diarrheal medications such as Lopex, Dimmer, Imodium, and Pepto Diarrhea Control, which are available as caplets, quick-dissolving tablets, or solution, are used to control diarrhea. Anti-diarrheal medications lessen the intestinal muscle movement known as peristalsis. For diarrhea, Imodium can be used. It may help diarrhea some, says Jonathan P. Kushner, MD, an associate professor of clinical medicine and director of the Digestive Disease Center at the University of Cincinnati in Ohio. But such medications shouldn't be used regularly to control IBS. If it's severe diarrhea, they need to be evaluated, says Dr. Kushner. They ought to consider if it's new, unusual for them, or severe for them. Also, Imodium may help diarrhea but won't provide relief from abdominal pain, Kushner notes. Fiber supplements to ease constipation or help resolve diarrhea. Products marketed as Benefiber, Citracel, and Metamucil increase the amount of fiber in the diet. You can get fiber in either a pill or a powder supplement, or special food products such as wafers and cereals. Fiber might help an IBS patient a little bit more for constipation or difficult evacuation, although occasionally it might help a diarrhea patient, says Kushner. Metamucil works well, according to Kushner. There are two kinds of fiber, soluble and insoluble. Knowing the difference between the two is important. Soluble fiber draws in and absorbs water, enabling stools to move through more easily and a little bit more slowly, which is beneficial in cases of diarrhea. Insoluble fiber does not absorb water and can help move stool more quickly, which helps for constipation. Medications to relieve gas and bloating, like Gas-X, acetaminophen, Tylenol, for pain relief. Tylenol is a better choice for OTC pain relief of IBS than a non-steroidal anti-inflammatory drug, NSAID, like Advil or Motrin that might irritate the stomach. Laxatives to ease constipation. There are a variety of OTC laxatives available, but it is a good idea to get a doctor's advice on what kind of laxative to have on hand, and what to keep in mind when using them. Chronic long-term use of laxatives can lead to other medical problems, like disturbances of the body's electrolytes including sodium and potassium levels, if done outside of a doctor's care. Probiotics, good bacteria to counteract the bad bacteria in the intestines. These are products that contain certain kinds of living bacteria that have beneficial effects when present in the intestinal tract. Examples of probiotic foods include yogurt marketed by Dannon and Organic Meadow. According to Kushner, probiotics can be useful in relieving pain and bowel problems in some patients with IBS. Some of the probiotics, and it varies which one you believe in, have had some modest effects, says Kushner. The studies are all over the place. The best study to date that shows a positive effect used something that was equivalent to the Procter & Gamble Align product. Align, a daily supplement, contains a microorganism called Bifidobacterium, which may help treat the symptoms of IBS. Treating IBS symptoms. Natural supplements. A number of natural supplements have been reported to lessen IBS miseries. These include evening primrose oil, grapefruit seed extract, psyllium, a natural laxative, and peppermint oil. Of these, peppermint oil has been the best studied, including using the gold standard randomized double-blind trials, where neither participants nor evaluators know who is receiving the actual drug or a non-active look-alike called a placebo. Still, the exact mechanism of peppermint oil is not clear. Moreover, even the best designed trials have produced disappointing results. Peppermint oil seems to reduce gas and bloating, but it does not work in all patients, says Anthony Starpoli, MD, Director of Gastroesophageal Research and Endosurgery at St. Vincent's Hospital in New York City and an assistant professor of medicine at New York Medical College in Valhalla, NY. Bottom line, peppermint oil has been shown to help alleviate IBS symptoms in some patients. Enteric-coated peppermint oil capsules may help to relieve crampy pain associated with IBS, says Kushner. Special coating on these capsules ensures that the oil will not be released before it reaches the small intestine. Treating IBS symptoms. Preparation is key. When you're a caregiver for someone with IBS, it's a good idea to be prepared for any type of situation since IBS symptoms can vary from day to day. If you stock up on some basic remedies to have on hand when your loved one's IBS symptoms strike, you will be able to better provide prompt care and treatment.